Hi, I'm Jim from Area Ordnance Depot, and today we're going to talk about range first aid equipment. I carry in my vehicle this barrier. It's a one-way valve and mask that connect together, and you can, if you have to give CPR or breathe for someone, allows you to breathe for them, and is a one-way valve basically. For example, if you're breathing for someone and you don't have their airway just proper, you could be blowing air into their stomach, and once that stomach is pressurized and fills up with air and you start doing some compressions, or someone else does, you could end up with their lunch or supper coming back up where you're putting air in. So this will help prevent you from getting that. So I also have this bag here, and on the outside where it's easy to get to, I have some emergency shears, and these will cut through even thin metal as much as they'll go through belts and boot leather, cut whatever clothing needs to be removed to access a wound. Inside I have the combat application tourniquet, which my assistant will help me demonstrate. And do is you take the limb, in this case an arm, and cinch it up, wrap it around, and then you tighten it and let it spring back into one of the little retainer pockets that are molded plastic. The cover, the strap, the newer models have a white strip where the person administering the tourniquet can put a time on there when the tourniquet was applied, so that medical personnel who treat the wounded individual can later know how long the limb has been without circulation. So this is a current issue item to military personnel. Since a lot of the people that are members of our club and also have are generally older folks, heart attacks are more and more common. So luckily we haven't had any at our facility, but in the event that we do, aspirin, I say, is good to give somebody. I keep a muslin bandage. This is the bandage that a lot of soldiers carry. You can use it for various wound wrapping, fabricated tourniquet. There's little examples of how to utilize the bandage, but it has no absorbency value. And another thing that's important is nitrile gloves. I use these for a variety of things. I use them for either handling brass, if I'm picking up brass on the range. If I don't have them in my range bag, I've got them in here, and that helps prevent you from getting contaminated with lead. I have another tourniquet that came with a different kit, and this tourniquet is an elastic band tourniquet. It's effective. It's probably not as good as the combat application tourniquet. 550 cord, leave that to your imagination, all the uses you can find for that. I have an actual gauze battle dressing. This is an old Carlisle bandage. It's a gauze packed bandage with a cloth outer shell that can be wrapped and tied on a wound. Band-aids. You'll probably use these more than anything. Somebody get a little bit of slide bite or something. So band-aids are a good thing to have with you if you're going to the range. Compressed gauze can be combined with a muslin bandage to work as well. This is a really neat piece of gear that's called the H bandage. My assistant's going to help me demonstrate the use of the H bandage. It's really simple to apply, and I'll show you that as a pressure bandage it's probably unmatched. It's part ace bandage, part pressure bandage. And we're going to take it's my assistant's arm, and we're going to place it on the arm. The Velcro gets wrapped here. You come around the H, tension it. On the other side of the H, tension it, and then you just unroll and compress the whole wound in the pressure bandage. And you can see that already he's getting the veins are starting to pop a little bit, and then you can terminate it by hooking it in on itself here. There, here you can see that his veins are popping, so he's put enough pressure that it would probably even work for some level of arterial bleeding. So we're going to take it off of him so he can keep the use of his limbs. I'll roll back up here. I'm Jim from Erie Ordnance Depot, back to finish the first aid bag. Inside I have a large trauma dressing. This can be used for chest, belly wounds, thigh wounds. A ace bandage like Sure-Band that can help add compression. Petroleum gauze. Steri-strips. Steri-strips can be used like butterfly closures to help seal a wound that will eventually receive stitches. Eye pads. Those could be handy to have if somebody receives an eye wound. A little bit of duct tape. Never hurts to have extra duct tape around. This is a nasal airway. This is the rubber hose that goes up the nose, so to speak. A little lubricating jelly for that to ease its entrance. I'd kind of hesitate to use some of this, as you'd have to be way out in the sticks and really need it to use this. Generally, you want to wait for your. Also have a 14 gauge needle in there and some alcohol. That's for another procedure that I'm not going to talk about on this video that requires an extensive amount of training. This is just an emergency plastic with a Mylar inside casualty blanket, so you can treat for shock. That's about what I have in. This is basically my range trauma bag. In my range bag I like to keep some sunscreen. That's nice to have too, and some insect repellent. Other than that, this is the extent of my emergency kit. If you guys have any other recommendations, or if there's anything that you see that I might have missed here, I'd be happy to hear your feedback, and that's all I have for today.